I'm Lindsay Cheshire, Community Relations Director at the Pinnacle at Plymouth meeting. I'm here today with Erin Fox, but I'm also here today with Colin Hunsberger and Jen Basile from Fox Rehab. We will be using Fox Rehab when we open, and we're very excited to ask them a few questions today.
Okay, so what are the benefits of having a rehab in a community?
So first off, thank you very much, Lindsay. Thank you, Erin. It's our pleasure being here today. Welcome to everybody in TV land out there. I guess YouTube land officially.
Yeah,
YouTube land. So we'll start with Fox Rehab. What we are really makes us a little bit different than other rehab providers. So for those not familiar, Fox Rehab, we are a private practice of physical, occupational, and speech therapists that specialize in geriatrics. Our goal as a practice in specializing with the older adult is really to maximize the functional health and wellness of the older adult so they can really achieve that high quality of life that they want to live, right? So with that idea, with that philosophy in mind of being that functional wellness expert on site, we bring in a full-time physical therapist, occupational therapist, and speech therapist into the community that will be working with the residents. And those therapists will perform not your standard home health type model of therapy, but they'll actually perform the outpatient style of therapy, which is a little bit more aggressive. It's a little bit more a higher level type therapy. And the benefits to that outpatient model, specifically at the Pinnacle, is traditionally you can only find that in an outpatient brick and mortar center. But with the Fox and Pinnacle relationship, we're going to be bringing that outpatient model in on site. So the convenience factor there for all the residents is that they can receive that higher intensity, higher level therapy right in the convenience of their own home. In addition, with the type of therapists that you'll all be getting is therapists that are specialized in geriatrics, therapists that are very knowledgeable in working with older adults and the traditional ailments or diagnoses that may come along as you age, things that are related to cardiopulmonary, oncological, orthopedic, dizziness, muscle atrophy, all those type of conditions for our therapists to provide the most appropriate intervention plan for that resident as research dictates is going to be best improving their own functional health. So we're excited. We think we got a really great team of PTs and OTs, speech therapists that will be coming and working with the residents. And lastly, I kind of just want to touch upon the relationship and how it will look from the Pinnacle and Fox side to really offer a full collaboration to provide a full wheel of services to all the residents. So beyond just the therapy that we'll be providing, the wellness team at the Pinnacle, in addition with the Fox team, will be doing very regular communication meetings, interdisciplinary team meetings, functional health and wellness presentations for the residents, for the staff, as well as looking at medical equipment. And lastly, the big program that we put in place is the fall risk reduction program. And the benefit to the fall risk reduction program is, in conjunction, the wellness team and the Fox team, we do a functional assessment of every resident that moves into the community to get a baseline score of how good or bad is their balance upon moving. And then we keep track of that resident as they progress in living at the community. So if we ever find out that, hey, their balance is starting to tailor off a little bit, we can proactively treat that resident with a therapy intervention plan that's going to get their balance right back on course, so where it should be. So we prevent any falls, we prevent any hospitalizations, and at the end of the day, we really keep the quality of life of that resident as high as possible.
Wow, sounds fantastic. Can you just touch a little bit on your areas of rehab that you offer?
Yeah, PTOT, SLP.
Sure.
That's a gem.
So each of our disciplines, as Colin mentioned, we will have a full-time speech language pathologist, occupational therapist, and physical therapist. Each of them have a focus, yet work together to treat the patient, your residents, as a whole. So that's the great thing with the team collaboration. But physical therapists, we look at their focus as living and moving with confidence. we want the residents to be able to benefit from our highly trained and competent physical therapists who will assess as well as address their functional mobility. You know, are they having problems with their balance? Are they having problems with pain? Has there been a limitation in their function? So these are all things that they will assess. We can do a screen when they move in. But some of the other areas that they may hit are, you know, are they having just overall muscle weakness, dizziness? Are they having problems with flexibility, which can then lead to a falls risk? Decreased endurance. Maybe they're having to walk longer distances in their new home. So just making sure that all of those areas are addressed so that they can maintain a great quality of life. Then we have occupational therapists, which I am proud to say I'm an occupational therapist as well. So what we like to look at, the focus is daily life made easier. So occupational therapists look at the daily activities that a resident would need to do from the minute they wake up to the minute they go to bed, and what makes their life meaningful, what's important to them. So our physical therapists are going to look at all of the areas that they would need that may be challenging to them. Maybe, as we mentioned again, living in a new environment. Could they have, are they able to do the household upkeep, medication management, looking at their dressing, their grooming, their bathing, as well as any dementia related limitations, and some caregiver education. We see a lot of that. So not only, as Colin mentioned, working with the residents, but the staff, you know, being able to work as a team and say, hey, these strategies are so important and are really working for Mrs. Jones. So being able to just have that that interdisciplinary communication, but also be part of the staff with the education, really helps to continue our therapy plans. So then we have our speech language pathologists who, as we say, they work on a very small area of the body, but have a huge impact on a person's life. So they are going to be looking at swallowing and eating and cognition and talking. So all these main areas of being able to communicate their needs and wants and keep them safe. So speech language pathologists are so important in that team because they work with both of the physical therapists and occupational therapists to make sure in the senior living community that there is a continuance of the program. So they're talking to the dining room staff, they're talking to the activity director saying, hey, remember when you're having the happy hour or some of the events that you have some of the foods that somebody on a limited diet can have and participate and feel, you know, like they're not excluded. So it's really a great area that they really try to get into. And some of the other areas would be, you know, the cognition piece, but chewing. Some people are like, oh, I'm not having problems with my swallowing, or I can eat my food, but they're not eating like they used to because they can't chew up their food that they like and things like that. So it's the little things that have a big impact. So those are the three disciplines that we will be working on.
Thank you very much. One of the big questions that I know families have been asking us is, what are your protocols and for, you know, COVID-19? What precautions are you taking for the safety of the therapists and your clients? As we, you know, call them residents, they're your clients.
Yeah. COVID-19 has flipped the script to a certain degree with the way in which you want to deliver care safely, right? Like you mentioned, not just for the patient, but for the healthcare professional as well, since that healthcare professional will be touching the lives of multiple residents throughout the entirety of the day, with them ensure their own health, to ensure the health of each individual resident they work with. So some of the protocols and precautions that we're taking. First and foremost, with everything that's occurring, our therapists don't just see themselves as therapists. They genuinely see themselves as essential healthcare personnel. And in understanding that the delivery of our services are more important than ever right now, we need to ensure we're delivering them safely. Why are they more important than ever right now? Well, we're probably familiar with quarantines and restrictions and social isolation, and unfortunately, the older population who we love and work with every single day, they get impacted by that exponentially more than maybe we do, right? Because they're that much more isolated, they're that much more quarantined in a room. And when you're stuck in a room for the majority of the day, you're not as physically active, you're not doing as much exercise, so you start to fall in this world of potential debility, right? To use it or lose it. Nothing's more true than that from a physical activity perspective. So if they're not using it, their functional health is going to start to decline. So we need to look at that and go, uh-oh, we don't want Mrs. Smith or Mr. Smith just quarantining in the room, not doing nothing physically. We need to engage them on a physical activity level throughout the entirety of this, so that once the restrictions are lifted, they're still living a high quality of life. And they haven't completely become debilitated to where now they're basically bedbound, right? So we need to continue to deliver therapy services in a cognizant way to protect their safety. How do we do that specifically now? So each of our therapists, PTs, OTs, speech therapists, before they start every day, they self-monitor for signs and symptoms of COVID. They take their temperature to ensure that they're not at risk of their own infection to pass on. Before every patient visit, they're performing sign and symptom checking on that specific patient, as well as monitoring the temperature of that specific patient, in this case, your resident. In addition to checking before a treatment session starts, once they start the treatment session, we now have to ensure universal precautions are being followed, right? So hand washing before and after, hand sanitizing before and after, sanitizing of all surfaces before and after. So typical universal precautions. At Fox, we've now taken it one step further than the CDC recommendations have had us have stated to do, because again, we believe in protecting the patient and the healthcare professional first and foremost. And in taking it a step further, we're now requiring that our therapist will wear a face mask, some type of eye protection, be it a face shield or goggles, as well as gloves. Also, if the resident is able, we'll also provide a surgical face mask to the resident to wear during the treatment session as well. It's not absolutely necessary to do that, but we believe it's just one more barrier of PPE that we can put in place just to further decrease the risk of infection. So we're going to take that step. And then lastly, we do have gowns that our therapists can use as appropriate, as indicated for certain cases. So we feel fairly confident when you install all those proper precautions in place, you're minimizing the risk of transmission of the virus to a very, very low level, as low as you could possibly get it, while at the same time still having the ability to deliver that pertinent physical, occupational, speech therapy care to keep the functional health and wellness of that resident high throughout the entirety of this quarantine process.
Well, thank you so much for being with us today. We are really excited that we're, going to be partnering with you guys in our community. Looking forward to all you're going to be able to do for our residents.
Looking forward to it. Thank you.
Yeah,
Thank you.
Thank you.
Thank you.